helping to bring awareness of a rare blood cancer that disproportionately affects Black people. Our next guest, Tiffany Hawkins Williams, is a patient advocate who is here to share more on multiple myeloma. We're glad to have you.
Thank you.
9-year survivor.
Yes. That's
wonderful.
It is. It's a blessing.
It certainly is, and I think it is in particular because often this disease goes undetected. Tell us a bit more about what it is.
Multiple myeloma is a rare blood cancer of the plasma cell, bone marrow plasma cells.
And it affects Black people disproportionately, men more than women.
Yes.
And the symptoms, so for your diagnosis, what led you to the doctor for them to then diagnose you with multiple myeloma?
The one symptom that led me to seek care was back pain. Not just that typical getting out of bed, kind of a sore back, but I was in my kitchen one day, I leaned over to do something, and when I stood up, I had an excruciating back pain.
Oh.
I knew it wasn't right. I knew my body. I knew that that pain was not a typical back pain. And so I immediately reached out to a neurosurgeon here in the community who had done a repair of a herniated disc the year before. And the pain was pretty similar to that. So I thought it was a herniated disc.
Oh goodness, and then when they came back and they told you what it was, you must have been in shock.
Yeah, so interestingly, we got an MRI, and the MRI showed that I had these lesions on my spine, so I was then referred to the cancer center for a workup, and had a workup for a suspicion of multiple myeloma. And yes, the diagnosis was devastating.
I can imagine. How long was treatment for you?
Active treatment was, I was diagnosed in November of 2013, and I started treatment immediately the next week after being diagnosed. And I received treatment, active chemotherapy treatment for 8 months, and then I had a stem cell transplant. And after that, I was started on maintenance therapy. So overall, really my treatment was about 8 years because I just stopped maintenance therapy last year.
You did?
I did, yes.
And in hindsight, though, your diagnosis when you had it was such a blessing because when we talk about some of the symptoms, you mentioned back pain, broken bones, fever, things that really could present as many different ailments.
Exactly.
And the survival rate for someone with multiple myeloma, what does that look like if it goes undetected, if you wait too late to get diagnosed?
So, and that is an issue because many people, particularly Black people, go undiagnosed for years, and by the time they're diagnosed, their disease is at a really advanced stage, which then leads to the increase in death rates among Black people. Prognosis when I was diagnosed was 5 years. Today, with the advancement of treatments and great novel therapies, people are living a lot longer.
So things have improved since your diagnosis?
Things have improved if you have equal access to care.
Indeed.
And that's the big key here. We're seeing Black people being disproportionately impacted because the access to care and health equity is not equal.
And I know you're working a lot in trying to bring that awareness, and also the campaign, That's My Word. So there's some famous voices that are coming to the aid of bringing awareness to this. So where do we need to go from here? So what more needs to be done to really feel like the community is being well represented?
Education and awareness. We need to make people aware that this rare blood cancer disproportionately impacts us as a community, so that we know we're familiar with it, we're familiar with the signs and symptoms, we're familiar with some of the resources, so that when a family member or a neighbor or a coworker or someone has those symptoms or is even diagnosed, we can help support them through that.
Absolutely. Is there some place where our viewers should be directed to get more information?
I would right now lead people to the That's My Word campaign, especially during March, the month of March, in the Myeloma Action Month, to find great resources and information that actually is targeted to the Black community to help decrease some of these burdens that we face.
Absolutely. Tiffany, I want to thank you so much, and we're so glad that you're here 9 years after your diagnosis. With a 5-year prognosis, we're so happy that you're here.
Thank you.
Thank you for sharing. We're back after this.